If you have any questions or concerns regarding your baby's hearing, please call Guam Early Hearing Detection and Intervention Program at 735-2466 or Guam Early Intervention System at 300-5776. Every baby born on Guam was provided with a hearing screening before leaving the hospital. Newborn hearing screening is conducted both at the Guam Memorial Hospital and at Sagwa Manyagu. From birth, one important way babies can learn is through listening and hearing. Although most infants can hear fine, at least 1 out of every 1,000 babies born in the United States have hearing levels outside the typical range. Newborn hearing screening helps to ensure that all babies who are deaf or hard of hearing are identified as soon as possible so that they may receive early intervention services that can make a big difference in their communication and language development. Hearing screening is important because hearing loss is invisible. Babies may respond to sounds by startling or turning their heads towards noises or familiar voices. But this doesn't necessarily mean that they can hear all the sounds around them and everything we say. Babies who are deaf or hard of hearing may hear some sounds, but still not hear enough to understand spoken language. Even a mild hearing loss can interfere with communication and language skills development. This hearing screener measures echoes that are produced by the inner ear. A tiny probe is placed just inside the baby's ear canal. Specific tones are played into the baby's ears. Healthy, normal hearing ears will send back robust echoes that are collected by the same probe. This screener is quick and easy to administer. It takes less than 5 minutes to collect echoes from each ear. This test is painless. Sometimes the child sleeps throughout the entire procedure. This test may be performed while your baby is sleeping, in a quiet awake state, nursing, or having a bottle. If your baby doesn't pass newborn hearing screening, it doesn't confirm the presence of hearing loss. More testing is needed with an audiologist that has the experience and the specialized equipment needed to diagnose and confirm the presence of hearing loss. The audiologist will also provide recommendations regarding amplification systems, hearing aids, or other rehabilitative services. If you have any questions or concerns, or want to have your baby's hearing screened, please call Guam Early Hearing Detection and Intervention at 735-2466 or Guam Early Intervention System at 300-5776. If your baby is identified with hearing loss, treatment and early intervention with a team of providers should start as soon as possible. Just like hearing children, children who are deaf or hard of hearing can achieve many things. Studies show your baby will have the best chance of spoken language development, close to that of hearing peers, with early detection, rehabilitation, and intervention by 6 months of age. The earlier, the better. If your baby passes newborn hearing screening, we still encourage you to monitor your child's hearing and speech and language development because some babies may develop hearing loss later in childhood. Causes of late onset or progressive hearing loss in children can include certain genetic factors, frequent ear infections, other infections like measles or meningitis, head injury, exposure to damaging levels of loud noises, and secondhand smoke. Newborns who need an extended period of neonatal intensive care can also be at risk for hearing loss later. Even if your baby passes newborn hearing screening, you should still watch for possible signs of hearing loss as your child grows. Talk with your pediatrician if your child doesn't startle at loud noises by 1 month or turn towards sounds by 3 to 4 months of age. Doesn't notice you until he sees you. Concentrates on vibrating noises more than other types of sounds. Doesn't seem to enjoy being read to. Is slow to begin talking, hard to understand, or doesn't say single words such as dada or mama by 12 or 15 months of age. Doesn't always respond when called, especially from another room. Seems to hear some sounds but not others. Some hearing loss affects only high-pitched sounds. Some children have hearing loss in only one ear. Has trouble holding his or her head steady, or is slow to sit or walk unsupported. In some children with sensory neural hearing loss, the part of the inner ear that provides information about balance and movement of the head is also damaged. Or if your child wants the television volume louder than other members of the family. These are some signs that hearing loss may be present. Remember, timing is everything. The sooner hearing changes are identified, the more likely interventions can help achieve your baby's full potential. Talk with your pediatrician if you have any concerns about your child's hearing or development. We also encourage you to call Guam Early Hearing Detection and Intervention at 735-2466 or Guam Early Intervention System at 300-5776 for more information.